So having seen the causes and symptoms of gastric cancer, we will see what are the methods to diagnose it and how to treat it. So diagnosis of gastric cancer requires a series of tests. So first and foremost, blood tests, how can it help? It can identify whether anemia is present. If we had lost blood through vomitus or through motion, that can identify. So other blood tests are essentially to find whether they are good candidates for further treatment. Now what will diagnose gastric cancer is the first and foremost test of choice is endoscopy. So it's a tube which has got a camera at its end and a small working channel through which one can go and take tissues for biopsy. Biopsy means subjecting it for microscopic examination and cancer can be proved. So endoscopy goes through the mouth, through the throat into the food pipe and then goes into the stomach, finds whether any extra growth is there, and if it is there, we take a biopsy. So this is what happens during endoscopy. Now if endoscopy diagnoses a gastric tumor or cancer, then how to find whether it has spread or not? In that situation, we require either CT, or if we suspect it could have spread to other organs, then doing PET CT is very important. Now what does it do? Within a tube, how is it diagnosed by endoscopy? Outside the tube, whether it has grown through the full thickness of the stomach, whether it has gone into the adjacent organs, whether it has gone into the lymph nodes, all these are identified by CT or PET CT. So blood tests, endoscopy, CT and PET CT are the investigations required to identify and stage the cancer. Now what are the treatment options available? Very early cancers, for example in Japan, where endoscopy is regular protocol to be done in all persons, not patients, after 50 years, we can even find gastric cancer very early. And then endoscopically itself we can remove a portion of stomach without requiring an extensive surgery. Now if it has slightly spread into the outside wall of the stomach or it has spread into the lymph nodes, then surgery can be done, preferably laparoscopic and robotic surgeries. Thing that has to be remembered is this required removal of either most of or all of the stomach and reconstruction using small intestine. Now is that enough? If it has already crossed the stomach into the lymph nodes or adjacent organs, it may either require chemotherapy or radiotherapy either before or after surgery. Now if it is from the stomach close to the food pipe, we preferably give chemotherapy and radiotherapy before surgery. If it is occurring in the portion of stomach close to the small intestine, we do surgery initially, then give chemotherapy and radiotherapy. So the treatment modalities available for gastric cancer include endoscopy in very early stages, slightly later stages surgery, slightly advanced stages surgery plus chemotherapy and radiotherapy. So these are the treatment modalities available. Thank you.